For our first panel, what we're going to do is we're going to take a tour around the world and hear perspectives from patients like you and their efforts to try to bring their lived experiences and their insights into advocacy and in terms of taking their experiences and impacting policy and considerations in their own countries. And so let's go ahead and take a quick run around the world.
So kidney disease has massively impacted me and my family. When I was 15, I was diagnosed with an acute kidney condition, and obviously my parents were in despair. They were very worried, and my immediate family was very worried for my safety because I was in hospital for quite a few months, but I managed to get through it. And from that point on, I had chronic kidney disease, and the nephrologist at the time that took care of me mentioned that I need to get a transplant within about a decade. My kidney would slowly depreciate over time. And over those 10 years, kidney disease didn't really affect me too much and my immediate family from ages 15 to 25. It was more the knowing that I would need to get a kidney transplant that maybe transpired in my head a little bit. Trying to avoid Google and the things that could go wrong and searching those things. I lived a pretty normal life for those 10 years. Then when I was 25, I had my kidney transplant, and psychologically, my dad probably would have been affected because he'd offered to give his kidney all the way back when I was 15. And that operation went seamlessly. And again, I'm sure that would have impacted my mother, with me being under the knife and my dad being under the knife. But again, that went successfully well. I then moved from Australia to London to kind of venture into a new career, and that went quite well. And over in London, I met my now wife, and CKD has obviously, and my transplant has affected myself and my family because it's been, especially over the past 2 years of the pandemic, a bit of a worry over my wife's head because she's been concerned, obviously, for my health and my safety and making sure that everything's going okay. Touch wood, the 10 years of my transplant have been quite positive. I've only had 2 hiccups where I've had to go to hospital twice because of a issue regarding norovirus and cryptosporidium, which is like an infection when you eat some food. But other than that, it's been quite positive, but it has consistently been a shadow in my life, and I'm sure for all my family members, which I'm very grateful for. My relationship with CKD, I think I've been quite insular until the past 5 years. So I've had CKD since I was 15, for about 20 years. I tried my best during my teens to brush it under the carpet. Um, Even when I moved to London when I was 25 post transplant, really tried to sweep it under the carpet as a condition that I tried to act as normal as possible, like most people do in regards to any condition that they may have, to try and fit in with the crowd. But my sister actually passed away from cancer in about 5 years ago, and it really kind of woke me up to kind of a shot in the arm to what I can do for my community, and really taking a broader look at my health condition and what I can do for other people with the skills that I'd amounted over the past 5 to 10 years in the world of marketing and consulting. So that's really where I had the inspiration to start my work with other patients. And over the past 5 years, I've tried my best to build apps for the community, to also build a number of groups on Facebook regarding food and nutrition, podcasts, anything I can really get my hands on to help other patients with the knowledge that they have. Because for my experience with CKD overall, it's been a lack of knowledge that has kept me in the dark, and a lack of facts, knowing that there's so many millions of other people that are in the same shoes that also hide in the shadows, worried about their disease, but too scared to tell anyone. So those are kind of the key catalysts for working with American Association of Kidney Patients and the wider CKD community in my country and the world. so many people live in the shadows with this disease, and a lot of that 850 million people don't even know that they have the condition. So the more people realize that the end stage of this is either transplant or dialysis, the scarier it becomes. And living with the disease myself, it is a scary factor to know that at the end of my transplant, be that at the end of my life or at, could be tomorrow, that there is this scary machine that you kind of get hooked up to 3 times a week. And innovation in that area is there is no words that can explain the feeling that you can have in knowing that end stage is not going to be that big machine that where you need to go to a scary hospital where a lot of people that are in that room look like they're on death's door. So in regards to home care, 100% would advocate that if there is any innovation to be pushed for in Australia or in the US or around the world, and making sure that as many people are on that as possible, just to live as anyone else would, similar to other issues like diabetes and heart care. There are lots of innovations in those areas that kidney disease is not up to yet in regards to the level that you need to take care of yourself on dialysis, which is kind of looks quite ancient when you show someone how kind of they live their life. In regards to the artificial innovation, that is spectacular, and anything in that, I think of, again, my personal experience at the end of my transplant, knowing that there is an innovation there that could replace potentially my current transplant, and I get to live the life that I'm living now in 5 years, 10 years, 20 years with something artificial, would be like a miracle, in the same way that my dad gave me his kidney and I have literally another human's kidney in my body working to make me live a normal life. So it would be almost like a second miracle, and I would advocate any innovation in that space and being as transparent as possible with the kidney community, because the group that I run on Facebook has about 20,000 people in it, and it gets posted quite a lot about the innovation around the artificial kidney, but there is a bit of misconception in how far away that is from human trials. So false hope is a worry as well. Imagine if you're on dialysis and you get that news that there's an artificial one coming out, or your transplant is failing, or you're in stage 5 CKD. So I think transparency with the community is one, the patient community is one thing that the medical community needs to be clearer with, and that is another part of the question in regards to my relationship with doctors. I'm consistently speaking to doctors because of my innovation in the space. As I said, I've built apps for patients. I'm currently building a website for food nutrition for patients. I run a podcast that's patient focused. And one question we get all the time is the relationship between patients and doctors needs to be much more transparent and less more of a teacher-student relationship, because the patients just want to have their say, and there's so much that doctors can learn from listening to patients, as opposed to dictating to patients on what they need to know, because there's a huge gap of information that's not being shared that could be helpful in the process of innovation. This particular question is my favorite so far, because it leads into what I've uncovered in the 5 years that I've worked as a patient trying to drive innovation in the space of kidney disease. And it is the fact that patients don't have a voice, yet in a capitalist world, we are the customer, because we are the people paying, and we are the people also experiencing the traumatic issues that we go through on a day-to-day basis. I sincerely recommend having a global consortium, because the disease is agnostic of whichever country you come from. When I presented over at Kidney Week over in the USA in 2019, I challenged a lot of doctors to stop using the word patient-centric, because I believe that it is overinflated in the medical world, because I almost guarantee you in every innovation pot, every doctor circle, there is no patient voice. Yet the patient is the person suffering on the day-to-day basis, and the patient is the person paying for the healthcare or service provided. So a global consortium will not only help realize that there's 850 million people around the world suffering from something, which investors obviously would lean into. It would identify a lot of the key problems that patients have, agnostic of whichever country that they're within, and it would drive so much more innovation, because you'd see the true reasons of what's going on in people's lives, as opposed to removing the patient and assuming that this is the problem that they're tackling. The Decade of the Kidney, I was at the speech where that was announced in Washington for Kidney Week, and that was very inspirational from a patient lens, because you can see that there's so much working in the background to help in this space. To me, it means a lot, because obviously longevity of life and being here for me and my family is my number one priority. So knowing that there's a lot more prioritization on that makes me overwhelmed in happiness and makes me overwhelmed in hope for the future. But not just for myself, for the millions of other people that have to just accept with that this is the way it is for this particular condition, whereas other conditions are light years ahead. Numbers are projected by 2040 for kidney disease to be one of the dominant chronic conditions and global conditions that drive death. I think it's the top 5 by 2040. So knowing that this is a priority is very important for investors to understand, and to know that there is potential for growth in this area, for being able to create innovation that will return investment, but also, more importantly, save millions of lives of people that don't have any choice. If you look more broadly outside of the US, Australia, and the UK, which are places that I've lived and grown up, if you go to, say, third world countries such as Mexico or places in Africa or Asia, a lot of those people don't even have access to dialysis. So once you get to stage 5, that's it. So knowing that there's innovation in that space can save millions of lives in the future. So you're not only working on innovation that has high potential for return, but also for innovation that can save millions of lives, which should be a strong priority, and it's a big, big part of my life for the next 10 years.
I'd like to thank my fellow patients from around the globe, giving their perspectives and their insights and talking about their shared experiences. One of the universal themes that you'll hear is diseases are tough to manage, but the insights that you gain and how you can apply those in the policy process to make an impact and to encourage other people to make a difference and to increase choice and options for patients is a universal theme. And that's something that the American Association of Kidney Patients, we incorporate that with our allies and we push it forward. And I really want to appreciate the folks that spoke today, because it takes courage to stand up and have your voice counted. Thank you.